potentially do neutralization. They can't really activate anything else because their constant segments are buried. Though they do activate some complement proteins. Then a lot of them, after making some IgM, will switch to making IgG. These are the most prevalent antibodies. They're about 80% of what's in your circulation. And that's why most listings of antibody classes put them first. They are just a single Y. Their constant segment is great for activating complement proteins. And it's used mainly to fight viruses and bacteria. You'll get some B cells that will switch over to making IgA. IgA has two pieces with the constant segments hooked together. These are found in secretions. So, tears, saliva, milk, and so on. And they also mostly fight bacteria and viruses. Then the other one, IgE, looks about the same as IgG, but there's something a little different on the constant segment that makes it bind to mast cells. And therefore cause inflammation. I list it last because once a B cell starts making IgE, it's never going to go back. Once a plasma cell, more specifically. But usually it goes, it makes D, then M, then G, and then it might switch to A or E or keep making G. And there are some that keep making M. And that way you can get a variety of effects. So here's what they look like. So the differences between G, E, and D are pretty subtle. It's just a little bit in the constant segment that makes the Ds stay in the B cell membrane. It makes the E's bind to mast cells and basophils, and the G stays circulating. Your anti-RH antibodies are IgG, and that's why they're small enough to cross the placenta, where anti-A and anti-B are IgM. It's 5 times the size, and so these don't cross the placenta. So there's no problem if a mother who's type O is having a baby that's A or B. It's only if you're Rh negative that your antibodies can get in there and cause a problem. Then IgA in secretions. So that'll help fight things in the digestive tract because it's in the saliva, in your eyes because it's in tears, and it's in breast milk, so it will help the baby fight off any infection that you've developed immunity to. Questions on antibody classes? So we said these defenses are adaptive. That means they're going to respond better when they've met an antigen before. The first time they meet it is called the primary immune response. And it takes them some time to get going. And that's why you get sick when you're exposed to a new virus or something. So it takes some time for B and T cells that would recognize that antigen to find it and then become activated. It takes 5 to 10 days until there are measurable levels of antibodies in the plasma. During that time, the pathogen is reproducing. It's enough there to make you sick. The plasma cells will produce the antibodies for a few weeks and then die. The memory cells remain. In the secondary immune response, so this could be the second time, the third time, the fifth time, the 99th time you meet this antigen. You get a secondary immune response, which is much faster than the primary. The memory cells recognize it right away and immediately launch the attack. Your B cells don't have to go find a helper T that recognizes the same antigen to get activated and make plasma cells. So the antibodies get into circulation within 2 days. There are more of them and more IgG, which is the most effective, and they keep making them longer to really make sure it's gone. So this chart compares overall antibody production in primary versus secondary. So here we don't get a peak until 12 to 15 days in, and this is as high as it gets, where in the secondary response, we've got a max in less than a week, and it stays high longer. And that's why you don't get sick again.
Some of you is lower on your IgG or those
Yeah, like if they're not, if for some reason they're not able to make enough antibodies, then they could still get sick the second time, and that's a form of immunodeficiency, of not being able to keep up. And there's a lot of different reasons that can happen. There's genetic, there's infections that damage the plasma cells, that kind of thing. What vaccines do is expose you to an antigen in the weakened form to stimulate the primary response, usually without making you sick. A lot of the effect you usually get, if you feel kind of run down when you've gotten a vaccine, that's the effects of your immune response rather than the antigen that's in it. Because some of the things the lymphocytes do is release chemicals that make you tired so that you'll rest and let them have the energy. And so you've already done the primary immune response, so then when you find the real pathogen, you go straight into secondary. So this leads us into different categories of immunity, like how you are resisting something. Active immunity means you've got plasma cells making antibodies. Passive immunity is you get the antibodies from somebody else. And antibodies, like any protein, will break down over time. So you only maintain the immunity for a certain amount of time. Where active immunity, as long as you've got memory cells, then you'll stay immune to it. This is why sometimes we need booster shots. Like if the memory cells die off sooner, you need to activate them again. Immunity can be either naturally or passively or artificially acquired. Naturally acquired is there's no technology involved to get you making antibodies or get you the antibodies. Artificially acquired is usually given by injection, although there are some oral vaccines. So you put these together, you get 4 types of immunity. It's either active or passive, natural or artificial, and we'll go through some examples of each type. So naturally acquired active immunity is you get the disease once, and then after that, you are immune to it. Okay? Most colds are this way because we don't have cold vaccines. But there's so many different cold viruses and they're mutating all the time that there's always some other cold out there you can get. Artificially acquired active immunity is from vaccines, where we introduce the antigen to you on purpose so that you will start making the antibodies. Naturally acquired passive immunity is almost always babies. And they get the antibodies from the mother, first through the placenta, and those last about 6 months, and then if they're breastfeeding, they're getting the antibodies replaced for the full amount of time that they're still breastfeeding. Artificially acquired passive immunity is an injection of the antibodies. These are used for things like, I'm going to travel to someplace where malaria is prevalent, and as far as I know, we don't really have a malaria vaccine, but we can inject you with some antibodies that fight malaria to help you resist actually getting it for the time that you're there. Snake bite shots are also antibodies that will neutralize the venom.
When you get a flu shot when you're pregnant, would that be naturally acquired passive or artificially acquired?
The flu shot while you're pregnant would be artificially acquired active immunity for you and naturally acquired passive immunity for the baby who is getting your antibodies. And our last thing, I think we'll go ahead and finish up the chapter and then take a break and then do the video. That's the focus activity. Our last thing is hypersensitivity reactions. So this is when you have either an immune response to an antigen that's not actually harmful or too strong a response to any antigen. Major types are allergies, tissue rejection, and autoimmunity. So there are actually 4 classifications of hypersensitivity where you're overreacting to something that's not harmful or maybe a little harmful, but your response causes more trouble than it does. Allergies are the most common of those 4, so they're called type 1 hypersensitivity or immediate reaction hypersensitivity because it happens very quickly after exposure. Any antigen that triggers an allergy is called an allergen. And we know some pretty common ones: pollen, cat dander, that kind of thing. Mold for a lot of people. So allergies occur similar to getting exposed to any antigen. On some exposure to the allergen, you activate B cells and some plasma cells start producing IgE. Now, this can happen way down the line if you've been exposed to something a whole bunch of times and suddenly you become allergic to it. Like, well, I was never allergic to penicillin until I was almost 30, and I had gotten it IV while my son was, while I was in labor. I was okay then, but then the next time I had it for an infection, I got hives all over the place. And I'd had it lots of times as a kid. My brother became allergic while we were still kids, but I didn't. So on the second exposure, at least after you've started producing the IgE, those antibodies are already attached to the mast cells. And so as soon as the allergen gets to them, it attaches to the IgE, activates the mast cell, it goes, histamine, heparin, inflame, inflame, danger. So it looks something like this. That's a pollen grain. So the B cell encounters the allergen, and it goes, okay, that's the antigen I'm looking for. Makes some plasma cells. The cells release IgE, binds to the mast cells. Allergen comes back. Now the receptors, the IgE, are already on the mast cells. You react right away. And that's how you can get things like, oh no, they fried this in peanut oil, and the instant it touches your lips, you're swelling up. Or if you're allergic to cats and you go into somebody's house and they have them, you're suddenly all stuffy right away. So allergic responses can be localized or systemic. Localized would be a skin irritation or inflammation in the area that you're exposed. Like, you're allergic to a particular detergent and you pick up something with it that had it on there and your hands get red and unpleasant. Nasal allergies is when you're inhaling the allergen and you're all reacting right here just to try to block it out. Systemic responses include hives, so wherever you've been exposed to it, often by eating it, it comes up everywhere. And difficulty breathing because the airways swell. And that's the most severe reaction. It's called anaphylactic shock, where the airways swell up to the point that you can barely breathe. Questions on allergies? And if you know about taking epinephrine shots for anaphylactic shock, what happens there is they dilate the airways, and that should counteract the swelling long enough for you to get better treatment. Tissue rejection is when you've gotten a transplant or a graft and your immune system recognizes it as not being part of you.